Hello everyone, welcome to Try Right. This is Pack 365. Myself Srija. So today in this session you're going to learn about the continuation of guidelines for injury, poisoning and certain other consequences of external causes. So these are from chapter 19 ICD-10-CM book. So the second guideline of burns is burns of the same anatomic site. Actually, when burns occur, they occur at the same anatomic site on the same side of the body, but they are of different degrees. So you have to code only the highest degree burn. Why? Because the highest degree represents the maximum tissue damage. So lower degree burns are included and not coded separately. So here is an example. Second degree plus third degree burns of right thigh. So how do you code it? You have to assign the third degree burn of right thigh first. So you have to only code the third degree burn as it is a highest degree. So it represents the maximum tissue damage. So you have to assign T24.311 code for the third degree burn of right thigh here. So next coming to non-healing burns. So what are non-healing burns? So burns that fail to heal and they also have the persistent open areas as well as they show the necrosis of the burn skin. So what is the coding rule for the non-healing burns? So you have to code non-healing burns as acute burns. So necrosis of the burn skin is equal to non-healed burn. So you should not code as aftercare, you should not code as sequela. You have to code as an acute burn. For example, the burn wound with necrotic tissue weeks later. So still it is coded as an acute burn code. So in the exam point of view, non-healing is still a acute burn. So next guideline is about infected burn. So for any documented infected burn, you have to code the burn first and then you have to add an additional code for the infection. So why you have to add the infection code? Because burn codes that do not identify the infection. So infection, it affects the treatment as well as the severity. So they are the common additional codes like cellulitis, L03, wound infection and sepsis. If it is presented and documented, you have to assign the additional codes for these infections. There is an example. If a patient record has third degree burn of arm with cellulitis, so you have to assign the third degree burn of the arm code as well as you have to give the additional code L03 for cellulitis. So this is how you have to assign the codes for infected burns. So next coming to fifth guideline, assign separate codes for each burn site. So you have to assign a separate burn code for each burn site. For example, a burn of right hand, a burn of left leg. So there will be two separate burn codes. You have to always assign each and every specific burn code for specific area or specific burn site. Use of category T30. So under category T30, so multiple body region are assigned if it is unspecified. So T30 denotes burn and corrosion body region unspecified. So it should be rarely used. Use only when the documentation does not specify the individual sites. So whenever documentation does not provide a particular site where the burn has taken place, so you have to assign this T30 category codes. So next guideline is about burns and corrosions classified according to extent of the body surface involved. So why do we code this burn extent? So the percentage of the body surface area, that is BSA, burn, it indicates severity, it helps to predict the mortality and it guides the burn unit care. So ICD-10-CM captures this using T31 burns as well as T32 for corrosions. So T31 category code, it is used for burns which are classified by 1% of the body surface, whereas T32 code, it is used for corrosions classified by percentage of the body surface. So when to assign T31 and T32 codes? So when the burn site is not specified, for example, patient has 30% total burn surface area burns, there is no body site listed. And when additional data is needed, especially for the burn registries, trauma statistics and burn units. So what is the important thing here? T31 and T32, these are the additional codes. These are not the replacements for site-specific burn codes. So what is the use of T31 for severity and reporting? What are the uses? So to evaluate the burn mortality risk for third degree burns involving greater than or equal to 20% of the body surface for public health and reporting purposes. So even when sites are coded, T31 adds severity information. So do not use T31, T32 for sequelae because these categories are used only for the acute burns or corrosions. So never use T31 or T32 for healed burns, for scars as well as for contractures. So there is a rule of nines basis for T31 to T32 category codes. So ICD-10-CM uses this classic rule of nines to estimate burnt body surface area in the adults. So body part is head and neck, which is assigned to the 9% of body surface. Each arm is assigned 9% of the body surface. Each leg is assigned 18% of the body surface. And anterior trunk assigned 18%, posterior trunk assigned for 18%, and genitalia, it is assigned only for 1% of the body surface. So altogether, it totals into 100% of this body surface. So there is a clinical example. A patient has third degree burns of entire right arm 9% and anterior trunk 18%. So how do you code? So we have to use the site-specific burn codes, for example, for right arm as well as the trunk. So T31.2 is assigned for the burns involving 20 to 29% of the body surface. So where it burn, it is a site code. So how much burn? It resembles a T31 or T32 category. So this you have to remember. So next is adjustment of the burn percentages. So what does it mean? So the rule of nines is a guideline, but it is not a fixed rule. So providers may adjust the burn percentages in infants or children where there is a larger head size compared to adults. So also patients with large buttocks, thighs or abdomen can also be adjusted. So why adjustment is needed? Because body proportions differ from each other. So the burn severity would be under or overestimated if adult percentages are used. So rule of nines is very flexible, especially in the children. So next guideline is regarding encounters for treatment of sequela of burns. So what is a sequelae? A late effect that remains after the burn has healed. So what are the common burn sequelae? Burn scars, joint contractures, skin tightness, deformities and loss of function. So what is the coding rule for the sequel of the burns? So you have to use the original burn or corrosion code. So you have to assign the seventh character yes as a sequela. So the burn itself is healed. So the patient is being treated for the result, not the active burn. There is an example. So a patient record has a scar contracture of elbow due to an old burn. So what you have to assign? Burn code with seventh character, yes. So this is how you have to assign the seventh character sequela. So next guideline is sequelae with a late effect code and current burn. So what is the key concept over here? A patient can have both. He can have a current burn as well as he can have a sequela of an old burn. So this is possible because burns heal at different rates. So when appropriate burn, you have to assign the correct burn code. And also you have to assign the seventh character A initial or D for subsequent or S for sequela. And also you have to code this old burn sequela code. So both codes can appear on the same record. Example, patient has a healing burn on the leg, which is the current burn. And he also have this old burn scar contracture on the arm, which is sequela. So you have to code leg burn, either initial or subsequent counter for the 7 character, and arm burn sequela you have to assign yes for the sequela. So why this rule exists? Because burn healing is uneven. So one area may still be healing, another area may already have permanent damage. So current injury and old damage can also coexist and they can code it together in a medical record. Use of an external cause code with burns and corrosions. So what is an external cause code? So it explains how, why and where an injury happened. So these codes usually come from chapter 20, that is V00 to Y99 series. So for burns and corrosions, an external cause code should be used to identify the source of the burn, whether it is a fire, whether it is a hot liquid, chemical, electricity, etc. And the intent of the burn, whether it is an accidental, intentional or assault. And also the place of occurrence, whether it is occurred at home, at a workplace, at school or on the road. So burn code tells what injury, external cause code tells how it has happened. So this is the difference between the burn codes as well as the external cause code. Here is an example. So patient has a hot water scalp burn at home. So you have to assign the burn code for the injury as well as the external cause codes for the hot liquid plus accidental damage plus the place of occurrence as home. So next guideline is regarding adverse effects, poisoning, underdosing and toxic effects. So T36 to T65 codes, these are all the combination codes. So they already include the substance and the intent, whether it is an accidental, intentional, adverse effect and underdosing. So no additional external cause codes is required for these cases. So T36 to T65 already tells us the full story. So what are the guidelines under adverse effects, poisoning, underdosing and toxic effects? So do not go directly from the table of the drugs. So why is this table used? To identify the correct code range and intent. So what is the golden rule over here? You should never assign the final code directly from the table. You have to always confirm and assign the code from the tabular list. So table guides you, tabular list decides you which code is a perfect code. Use as many codes as necessary to describe the situation. So what does this mean? If multiple drugs or substances are involved, so you have to assign separate codes for each substance. There is an example. If a patient overdosed on insulin plus sedatives, so you have to code both the substances. You have to give codes for one for insulin and one for sedatives, but do not overcode unnecessarily. Until and unless it is necessary, you have to give additional codes. So if the same code would describe the causative agent. So if one drug causes multiple adverse reactions or poisoning plus toxic effect, so assign the drug code only once. Some antibiotic causes nausea and rash for an example. So what you have to code, drug code reported once and symptoms coded separately if needed. So one drug code for only for one drug. If two or more drugs, medicinal or biological substances, are taken. So sometimes a patient takes more than one drug and the exact intent, the accidental, intentional, etc. cannot be determined or the exact drugs are not clearly identified. So in such cases, ICD-10-CM, it gives us specific rules. So when intent cannot be determined, refer to the tables of drug and chemicals to identify the correct code range. So the final code selection must always be confirmed in the tabular list. Multiple unspecified drugs taken. So how do you code in such cases? So if more than one drug or substance was taken and the drugs are unspecified. So how do you assign? You have to assign the code from subcategory T50.91. So T50.91, it denotes poisoning by adverse effect of and underdosing of multiple unspecified drugs as well as medicaments and also the biological substances. So you have to use T50.91 only when individual drugs cannot be identified and documentation clearly states the multiple substances. So what is a drug toxicity classification in ICD-10-CM? So drug-related problems are classified into adverse effect, poisoning, toxic effect as well as the underdosing. So the first one is adverse effect. So this is the most important one. So what is an adverse effect? When drug is correctly prescribed, properly administered, but patient develops a unwanted reaction. So this is called as adverse effect. So what are the examples of adverse effects? Nausea after antibiotics, tachycardia after bronchodilators, and gastrointestinal bleeding due to NSTs. So how do you code an adverse effect? So step 1, you have to code the nature of the adverse effect. For example, tachycardia, delirium, vomiting, hepatitis, renal failure or respiratory failure. So second step is you have to code the drug causing the reaction. So use T36 to T50. The drug code must have either the fifth or sixth character as 5. So this 5, it indicates the adverse effect. So effect first and drug next with 5. So in this way you have to assign the code. And there are some combination codes that already includes drug plus adverse effect. So then do not assign the separate codes unless and until a combination code is not present. There is an example. It's a clinical scenario when a patient develops vomiting after taking a correctly prescribed antibiotic. So how do you code? You have to code vomiting, the symptom code, and then adverse effect of the penicillin, adverse effect of the given antibiotic as T36.0x5. But you should not code as poisoning, so do not add the external cause code over here. So next is poisoning. So in ICD-10-CM, what is poisoning? It refers to the harm caused by the improper use of a drug, medication or substance. So this includes taking too much of drug, taking the wrong drug, taking the wrong dose and taking a drug by the wrong route. For example, oral instead of injection. So drug errors they made by provider, nurse or patient. So what is the first coding rule? You have to code the poisoning first. So when coding poisoning or reactions due to improper use of medication, you have to first assign the appropriate code from the categories T36 to T50. So these codes, they identify the drug or substance involved. So these are found in the chapter 19 ICD-10-CM, which denotes injury, poisoning and certain other consequences of the external causes. So example like if a patient overdosed on insulin accidentally. So you have to code from the category T38.3x1A, which denotes the poisoning by insulin accidental and this is the initial encounter. And the second coding rule is intent is mandatory. So poisoning codes require an intent which is shown by the fifth or sixth character. So types of intents, there are types of intents. The first one is accidental intent, whether it is an unintentional overdose or error. Second type of intent is intentional self-harm, that is a suicide attempt. And third type of intent is assault, like someone poisoned the patient. And the fourth type of intent is undetermined. So intent is unclear despite the documentation. So if intent is unknown or not documented, default to accidental. So now when to use this undetermined intent? So you have to use this undetermined intent only if the medical record clearly states that intent cannot be determined. So you should not use this undetermined just because the record is silent. The documentation is unclear. So unknown intent is not equal to undetermined intent. Both are different. Unknown is accidental. Undetermined is undetermined itself, where it cannot be determined furtherly. So the third coding rule is you have to code all the manifestations. So poisoning codes do not describe the symptoms. You must add the additional codes for nausea, for vomiting, for respiratory failure, for altered mental status, as well as coma, etc. There is an example, drug overdose causing respiratory failure. So T code you have to assign first for poisoning, and additional code you have to assign this J96.00 for respiratory failure. And next, coming to abuse or dependence coding. So if documentation states drug abuse and drug dependence, so codes these separately in addition to the poisoning code. For example, poisoning due to opioid overdose and patient is an opioid dependent. So you have to first code the poisoning codes as well as opioid dependence codes, that is F11.20. So what are the examples of the poisoning? Error was made in drug prescription. This includes wrong drug prescribed, wrong dose written, or wrong frequency, or a wrong patient. So considered poisoning but not an adverse effect. And second example is errors in the administration. So errors made by doctor, nurse, patient as well as a caregiver. For example, like patient takes double dose by mistake. Nurse administers medication via a wrong route. So poisoning code applies in this case. And third is intentional overdose. So patient knowingly takes excess drug, like it leads to a suicide attempt and also self-harm behavior. So you have to code with intentional self-harm character. So the example is T40.2x2a, poisoning by opioids, intentional self-harm. So what are the common exam confusion? Poisoning versus adverse effect. So if the situation is wrong dose or overdose, you have to code poisoning. If the situation is a correct drug, correct dose, expected side effect, it is an adverse effect. If a wrong drug taken, it is also comes under poisoning. And if an allergic reaction takes place to a correct drug, it comes under adverse effect. So this is how you understand adverse effect and poisoning. So intentional overdose. So if an overdose of a drug was intentionally taken or administered and resulted in the drug toxicity, it is coded as the poisoning. So any intentional overdose, it is equal to a poisoning. So intentional includes suicide attempt, a self-harm, and also deliberate excessive intake. Toxicity, it does not change the classification. An intentional overdose is never an adverse effect. So you have to assign T36 to T50 code first. Then you have to use intentional self-harm character, usually X2. And you have to add codes for manifestations like coma, vomiting and respiratory failure. A third guideline is non-prescribed drug taken with correctly prescribed and properly administered drug. So if a non-prescribed drug is taken along with a properly prescribed and administered drug, and toxicity occurs due to interaction, you have to classify this as a poisoning. So this applies when a correctly prescribed drug is taken properly and patient also takes this OTC drug, herbal product, someone else's medication and recreational drug. So if interaction causes harm, it leads to poisoning. What is the important distinction here? The prescribed drug is not incorrect. The combination causes toxicity. So here the combination is problem but not the prescribed drug. So next is interaction of drugs and alcohol. So when a reaction results from interaction of the drug and alcohol, it is classified as a poisoning. So alcohol is considered as a toxic substance. So combining alcohol with medication, even correctly taken, it can cause the CNS depression. CNS means a central nervous system depression, respiratory failure, hypotension, and also coma. So you have to always code it as this poisoning. For example, when a patient drinks alcohol while taking benzodiazepines, so it leads to respiratory depression. So you have to assign two codes, one for poisoning by benzodiazepines accidental and the other code for the respiratory failure. Insulin pump malfunction. So you have to refer section IC4. So if insulin overdose occurs due to pump failure, you have to code the device complication. Then you have to assign the code for poisoning. In the same way, sequela. So you have to use when long-term effects remain after the poisoning. So you have to use seventh character as S. So next is underdosing. So you have gone through poisoning, adverse effect, and now it is underdosing. So what is underdosing? Taking less medication than are prescribed or instructed. So underdosing, it includes skipping doses, reducing dose on own, and stopping medication without provider instruction, and also not refilling the medication. So this is not the poisoning, this is the underdosing. So what are the coding rules for underdosing? So you have to code the condition first. Condition means the illness which is being treated. For example, like hypertension and diabetes. So second, you have to add the underdosing code from T36 to T50 with sixth character 6. And third, you have to add the reason for underdosing. So you have to use Z91.12 or Z91.13 codes. This is how you have to code this underdosing. Example, a diabetic patient skips insulin. It leads to hyperglycemia. So you have to assign the code for type 2 diabetes with hyperglycemia, that is E11.65, as well as you have to assign the code for underdosing of insulin, T38.3x6A, and additional code for patient's intentional underdosing, Z91.128. So one for complication, the other for whether it is an underdosing or not, and third is whether it is an intentional or unintentional thing. So this is for today's session. I hope the session has helped you. So in the next session, you will be able to learn the continuation of this underdosing guidelines for chapter 19 ICD-10-CM coding book. Thank you.